We're so excited to have Christy Baynes with Life Care for Seniors speaking to us today. Many of y'all are very familiar with Christy and the work that she does as a geriatric case manager. You know, she does a whole lot behind the scenes, and she has been an integral part of Alzheimer's of Central Alabama for many years, serving as our president and serving on our endowment board. So we're really grateful for everything she does every year. At our garden art party, that's actually, of course, been postponed or / canceled for this year. But as I said, she donates, helps us with Super Bowl tickets and raises money that way, donates her husband for the garden art party as a coach with the NFL. And it's just really nice to have somebody in our corner who uses every resource that they have to benefit ACA. And that includes her vast knowledge of how to navigate the healthcare system. And I looked through her slides and I thought this is exactly what we need right now, because she's really updated a lot of this information to make it COVID related. And I think we're all kind of struggling with what we would do if a crisis came up right now. So I want to welcome Christy, but I also want to thank Katie Cochran, who is with Home Instead. And Katie is helping with CEUs. And Katie, you've got a word of housekeeping.
A word of wisdom, yes.
Word of wisdom.
If you, there's a survey, if you were on here at CEUs, there's a survey through SurveyMonkey that is going to pop up when it's going to come to you after this presentation. We're also going to put the link in the chat. So be looking for the link in the chat at the end. And if you're a nurse or a social worker, please make sure you fill that out, because that's how you'll get your CEU. And I will send a certificate. The social workers will need a certificate, and I will manually enter in the nurses to the Board of Nursing. And in the survey, it asks for your license number and your name as it appears on your license. So just be sure to do that, and then I'll have all that information from SurveyMonkey. And if you're on here by phone, I don't know if anybody's called in, make sure you email Miller or Sherry to let us know that you were on this call. And I think that's it.
And finally, Christy did have a handout, and we could not figure out how to get it attached and sent out, but we will send it out after the event so that y'all will all have that. I will email that out to y'all individually. So, and if you're emailing me back with anything like that, you know, we would love to hear your thoughts on potential upcoming webinars that might be helpful to you. Dr. David Gelmacher will be joining us next Wednesday on the 15th at 2 o'clock to give an annual research update for us. And so I'm really looking forward to that. He always tells us what the latest is and sort of what's going on policy-wise with Alzheimer's. So that will be another very informative program. So without anything further, Christy, thank you again for being here with us today.
Thank you, Miller. And ACA has always been very near and dear to my heart. I have known Miller. Miller, you and I have known each other since I got into geriatric care, and it's going to date us, but it was back in the 90s.
Yeah.
Anyway.
I think it's dating me a little more than it's dating you, but yes.
Well, no, but always just a huge fan of ACA, and not only is it near and dear for Alan and me, but my entire team. We just love and support ACA. Nicole Crawford, that's on my team, y'all don't know, but she's right next to me. She might wave in a second, but she was also president of ACA. So definitely an organization that we feel is so important in our community, and we've seen what it has done for the healthcare, persons with dementia, their family members, and even the healthcare system, if you will. So thank you, Miller, Vance, everybody. And everybody needs to go give a birthday to Vance. So that's on my to-do list, because he might come after me if I don't. So I know that anyway. Anyway, so we're going to jump into navigating healthcare during uncertain times. And Katie, again, thank you for the CEs. First off, let me say, this changes every day. You know, if you as a family member are frustrated, if you as someone that works in the community or in the hospital, or any of us on this call are frustrated, we're all in it together. It changes every day. And how can we navigate this together? So without COVID, we do a lot of work navigating families through just the general silo effect of healthcare. Well, now we're navigating through what's already a fragmented system, now a fragmented system that the rules change every day. And we are also serving the most vulnerable population. And how does this look? We're all very nervous about, and this virus is definitely front of mind for all of us. And we've got to continue to maintain all of the rules and healthcare guidelines that they're giving us. But, you know, I'm also concerned, and this has been something that we've talked about in our team meetings for a long time, you know, what is this doing to our vulnerable clients that are in facilities or at home by themselves? And what does this look like for their ongoing mental health, not alone, you know, and their family members? So we're going to jump in. Most of this is designed, or all of this is really designed more for the family member and how to navigate with their loved one. But anybody that's in the healthcare system can pass this information along because it's very helpful. And a lot of this we've learned as we go. So Katie, if you don't mind turning to the next slide. We're doing technical team project here because I couldn't figure out how to share my PowerPoint.
You know, I did it accidentally earlier. All right, sorry guys.
Hey, this is we're learning it. There we go. We're learning as we go.
You know what? I don't even know what I pushed. So,
well, whatever you just pushed, be ready to push again in just a second. Okay. All right. So our three objectives for today. How do we prepare for telehealth visits and in-person visits during a pandemic? Most of you have probably already experienced a telehealth visit, and what does that look like? And I will say, I think for our population, I could see this becoming definitely part of a normal healthcare system. You know, we already have organizations and clinics that have a house call program, but you think about even before COVID, how difficult sometimes it is to take our loved ones, particularly those with dementia, out of the home or out of the community to an appointment. And is this going to be an option ongoing? And it very well may be. How do we prepare for emergency care and hospitalizations, particularly right now? And how to provide care and advocacy for your loved one in long-term care communities. So that's where we're going to start first. All right, next slide, Katie. Okay. This is how to prepare for a virtual doctor visit, right? So I wish I could have a show of hands, but I'm sure many of you have already had this experience. Katie, Miller, have either of you had a situation where you've helped somebody with a telehealth visit?
Not yet, and I've not had one yet. What about you, Katie?
I've had one myself, and it was pretty easy, but I don't know, you know, the seniors, I think are going to have a more difficult time, but maybe you know, they're going to make it easier. But right now it was kind of confusing a little bit.
It is, and you know, here we are on Zoom, but a lot of the clinics are going to have to use specific HIPAA-related applications, apps, whatever, or something that's specific to their healthcare system. So that's, you know, first off, we want to confirm that your insurance is covered. Medicare has really loosened the rules here. So if you're on Medicare and a hospital and a normal health insurance, most everybody is covering telemedicine now. So that really shouldn't be that big of a deal. But there may be a copay that you need to know about, and ask those things of the clinic. Also, ask the doctor's office about required technology. And Katie, you might have experienced this. Let the clinic know what type of devices you have. Are you using a smartphone? Are you using a computer? Are you using an iPad? And if you're going to have a telehealth appointment, which one can you use? What if you don't have any of those? Can you do something over phone? That's all going to be up to that particular clinic. But before that appointment comes up, they should be sending you some information about it and then you need to test it, right? So you're going to have to, if it's an app, a particular app that you need to use, you're going to have to download the app, establish an account on the website. And what if your loved one's in a community? So that's where you're going to have to contact, whether if they have a caregiver that's with them, or if it's a nurse or a unit coordinator that's going to help. Make sure you've walked through that process with those folks so that it's up and ready to go. I don't know if you've experienced this, but I know that our Zoom meetings are a lot more efficient these days. However, you can find yourself loaded up with 5 or 6 Zoom meetings in one day, and all you're doing is going from Zoom meeting to Zoom meeting to Zoom meeting. So the doctors are doing this as well. They're not having a big pause. So if there's this technical difficulty, kind of like Miller and Katie and I experienced when we first jumped on today, you're losing some time on that involvement with your physician.
Christy, I hate to interrupt, but I want to.
Yeah, go ahead.
I think there's something called Zoom fatigue that like a real thing, because somebody was telling me that it was a real thing. And so I'm just waiting in the next year for it to be an ICD-9 or an ICD-10 code.
Right.
I like texting some.
We're going to all need therapy from it, right? And so now we've got a situation where we're going through this, and now we've got a loved one, and what if that loved one has dementia? And what if you're not able to be with that person with dementia, and they're with, a CNA or a nurse in the community, and they're having to look at the doctor on the screen. They don't understand what's going on. And so there's just a lot of things that we need to be prepared for that. And that's why I say, so, it goes confirm, ask, pick. I'm going to jump down real fast, then come back through those others, but write down the symptoms, the questions, take the pictures of any issues, any visible symptoms that may be going on with your loved one prior to this meeting. Make sure you have all that information available, and we will go over the patient portal on another slide, but using that patient portal with your doctor's offices is so vital. It was vital before COVID, and now it's most important. So making sure that you get that information to your doctor ahead of time can help with these things. Because what if the last minute Wi-Fi is out? Last Friday, Nicole on our team was ready to go on several appointments, and storms came through, knocked off a power pole. Now she's stuck in her house, no power, no Wi-Fi, anything like that. And what if she had to have a visit? What if she'd had to make a doctor's visit? So how do we plan for these changes and things like that? So if we can be prepared ahead of time. So again, confirm the insurance coverage, ask the doctor's office about the required technology and test it out. Again, that could be an app, whatever. Make sure you're in a location that's well lit, that's private, so you don't have, I don't know how many times y'all have been on Zoom meetings and you have birds chirping in the background and garbage trucks going by, or someone else in the family's coming up and bothering you, or you're in a location and the Wi-Fi is not good. How many times have y'all been on a video meeting and all of a sudden your face is stuck in some distorted way and you can't communicate? So checking all these things out ahead of time is very important. Again, if you've got something that's a change and it's a visible change, take a photo so that the doctor can see those things. Have your medical devices handy. Do you have a set of scales? Do you have a blood pressure cuff? Even like an electronic blood pressure cuff. If you're diabetic and you're having to take your blood sugar levels, do you have your blood sugar monitor with you so that you can go through the history of those things with your doctor while you're sitting there with them? They may ask you to weigh yourself. They may ask you to take your temperature. Having that information or those devices available to you is going to be really important, so that and maybe you go ahead and do some of those things before you actually jump on with the doctor so you can be ready. And then again, write down any symptoms or questions that you have for the doctor. And if you can, get those to him or her prior to the appointment so that you can go through those during that time. Okay? Next slide, Katie, if you don't mind. Preparing for in-office visits. All right, things are starting to kind of change a little bit. We are now having some in-clinic appointments. Just yesterday or 2 days ago, my daughter had an orthodontist appointment, right? I started getting text messages well ahead of time before her orthodontist appointment. And it's, when you get here, don't leave your car, call us. When you get here, call this phone number. Make sure she has a mask. You cannot come in with her, right? That's just for the orthodontist. What if you're going into a clinic with someone with dementia? That's something you need to check beforehand. Can somebody accompany them into the clinic? If so, it's probably only going to be one person, right? So pick the person or the advocate that has the most information that can help them. Where do they need to check in? You're not only going to the clinic right now where you just have to give your insurance cards and what have you. You've got to be prepared to, answer the 3 or 4 questions that they're going to prior to you coming into the clinic, which is, have you been exposed to somebody with COVID-19? Have you been out of the area? Have you traveled? What's your temperature? All those different things. And make sure you know what that protocol is before you take somebody. Be prepared for a temperature check. And a lot of places, they may go ahead and ask you to put gloves on. And typically they'll have a box of gloves sitting there waiting on you. And of course, please, please, please wear your mask. If symptoms develop prior to that appointment, be smart, communicate with the clinic, and see if you can switch to a telemedicine appointment or what you need to do. Because that's really important that we be aware, even if this is, let's say this is a well check, or it's a check that a follow-up with a physician, that it's not an emergency situation and you've had to reschedule and you just want to get it done. If you or your loved one, if you're taking your loved one to their appointment and then you've started developing symptoms, be smart and be aware and make sure that you don't take someone to the clinic if he or she or you yourself have any type of symptoms or anything. Prepare ahead. This is so important. This is for telehealth. This is for just ongoing. Most physicians these days have a patient portal system. Please, please, please go ahead, enroll your person, enroll your loved one, enroll yourself in the patient portal system and get familiar with it. UAB particular, it's so easy to navigate. There's a way that you can message directly to your provider. You can see when they've read it, when they follow up with you, and that becomes part of their healthcare record. We've had many situations where families are like, well, I've left this message, I've left that message, and there's no paper trail there. If you use the patient portal system and you put your questions and your detailed information about symptoms and changes in condition in that portal system, it's automatically part of the records. You can always go back to it and see where you sent a provider a message, and then obviously they sent back to you. So that's what I have listed here. Send any concerns, changes in conditions, notes, report of symptoms prior to the appointment. That's for televisit or in-office visit. And be specific. The doctors love to see if it's becoming a change in condition and it's someone with a memory impairment, and let's say it's a behavior. Is it a behavior that only happened one time, or is it a behavior that's gone over a course of time? For instance, it's always happening in the afternoon and it's happening about every other afternoon. What is it? What is it? We always want to go, let's look back and see what triggered that behavior. We've got a family we're working with, and the client had started exhibiting some anxiety and agitation with a neighbor, and the family was really upset. And they wanted to communicate with the physician. Well, what are you going to do to change this? Can you take a medicine? Can we change his or her medications? Well, the doctor can't just change a medicine over a patient portal message that this person's just had one little behavior problem. right? So when I met with this family, I said, go back and give me the full history. How many times did this thing occur, this behavior occur? What was the trigger of the behavior? And is part of it really the environment? Because if it's the environment, it's not like there's some magical pill that's going to change things, right? But the more information we can give the doctor or the nurse practitioner or the nursing staff, the better. So, and if your doctor doesn't have a patient portal system, then how can you communicate this same information? Is there an encrypted email system, or do they have a fax? And if you yourself don't have a fax, reach out to somebody that does. There's a great online fax program called MetroFax. We actually use it at our office. It's very inexpensive, and you can send it straight from your computer. You don't have to have the old, big, noisy fax machine anymore. Everything can be online if needed. But make sure you have all that information ahead of time. All right, Katie, next schedule. Okay, now we're preparing for a procedure. So, in May, we started seeing doctors start opening up more for things like mammograms or colonoscopies, endoscopies, surgeries that were just scheduled surgeries that were not emergency surgeries. They were, elective surgeries. And now everything that was kind of bottlenecked during March and April, everybody's starting to try to get these things done. My mother and my mother-in-law, for instance, one had a colonoscopy, one had an endoscopy. So we were getting all this text chain of, yep, I went and had my COVID test done, and this is what I had to do, what have you. So make sure you're prepared for that, and you prepare your loved one. If you've got to have if you're going to have a procedure, you're going to have a COVID test done. How soon before that appointment do you have to have the COVID test done? Where are the locations for those COVID tests to be done for that particular clinic? For instance, I had a client's son that needed to go have an operation on his shoulder or his elbow. And the specific orthopedic clinic wanted you to have their COVID test done in Trussville, okay? So know where that is and go ahead and get that done. Here's something that I've seen happen. A COVID test comes back inconclusive, meaning maybe there wasn't a good specimen or what have you. That can happen. So we may have to be prepared to go and get another COVID test done. It's just where we are. And I think all of us are very frustrated, and it is something that we're all learning to do together, but nobody's doing this because out of purpose or anything. It's just things are happening. We're all trying to change and support each other during this, but know that your loved one may be in the hospital and it may be time to transition to a rehab facility for therapy. And they can't go to the rehab until they have a negative COVID test. Well, what if same thing happens? What if the hospital forgets to do the COVID test? Or what if it comes back inconclusive? Just know that these things can happen, and we just need to be flexible with them. If somebody has a procedure, and particularly if that person has dementia, can somebody go with them into the clinic for that procedure? What are the rules? If they will not allow someone to go with them, then how can we communicate for our loved one? And this is where during kind of the downplay, when everybody was quarantined and nobody could go and do anything, one thing our team did is we looked at all of our clients, and yes, we have all this information for our clients, but we wanted to write a letter to healthcare providers speaking on behalf of our clients. What are their, how do I communicate with this person, particularly if they have dementia? What is the best way that I have found when Miss Sally gets anxious? How do I comfort her during this? She already gets upset when she has to go to the doctor's office and she has white coat syndrome. So how do I help this person when they can't speak for themselves? If they do get anxious, what comforts them? What are triggers that can make them more anxious or agitated? Can that person actually answer a questions appropriately from their medical history or anything like that? If they can't, and the clinic or the place where they're having a procedure won't allow somebody to go in there with them and be their voice, then you've got to be their voice for them, and you've got to put it on paper and write it on behalf as you're writing it for that loved one or that patient going to see, the radiology tech, the healthcare provider, whatever it is. But it's so important that we not only give them the medical information, but more of just that, how do you help this person during this? Whether you're a family member or you're one of us as care managers, we know what happens when our clients are in the emergency room or going to a doctor's office or whatever, and we know how to help them and comfort them during these situations. Well, when you can't be there and be present, we've got to get that communication to the healthcare providers. Any questions on that? Katie Miller, y'all good? All right. How to prepare for emergency care and hospitalizations. If you've ever interacted with us in a support group or heard me talk or have been involved with any of our clients, we are huge advocates of an emergency notebook, an emergency notebook, emergency notebook. My parents both have an emergency notebook. I'm hoping my in-laws have done it, but I know my parents have done it because I made sure I did it for them, right? This is so important. And this goes along, we're going to use that letter that we just talked about, but everybody needs to have this. For our clients, one thing that we do, and I'm going to recommend this for all of y'all, put it in a big bright red notebook. I mean, nothing says healthcare and emergency more than bright red, right? So put it in bright red in a big red notebook that's right there. If you're if your loved one's at home or if you're at home, make sure it's right there for if EMS is contacted, it's easy to hand off. Okay, so let's go to the next slide, and we're going to talk about the emergency notebook. On the cover of that notebook, we love just to have the basics. And let me say, if you don't have the red notebook, just make sure it's a copy that's kind of like this. You've got your cover sheet and all your information can be behind it, and it's stapled, okay? So on the front of that cover page, who's the patient? Put your patient name. If they have, so for me, I am on all of my legal documents, Christine, Vargas, and Baynes. Well, nobody calls me Christine but my grandmother, and my grandmother's long gone, right? Unless my mom wants to get on to me. But so I would be Christine, Christy, F. Baynes, right? We want to make sure that it's there. And then if EMS is talking to me, and I don't go by Christine, I go by Christy, they need to know who I go by. My date of birth, any allergies that I have right there on the front, my preferred hospital. Yes, we've all been in an experience where we really, really want to go to hospital X, but they're on diversion and you have to go to Y. But make sure on your cover sheet that you have what your preferred hospital is, especially if you've got most of your records in one system. And then who are your top emergency contacts? Put their name and their phone number right on that cover page. Then we're going to go through the checklist, which is the next page. In your notebook, make sure you have these items. Copy of your ID, whether it's a driver's license, any kind of photo ID, and your health insurance cards, Medicare cards, supplementary cards, drug cards. Make sure that's right there. Very easy. Scan it, take a picture of it, whatever you need to do, put that right there. Again, emergency contacts, current medication list, very important, especially if the person has dementia, or what if it's a situation where I don't have dementia, but whatever's going on with me, I can't speak on behalf of myself to EMS. I need to make sure they know what I'm taking currently right now. Any recent summaries of medical and personal information. So if you're on the patient portal, you could pull up some of those last few visit summaries and put that in there. Or, you know, most of the times when you leave a clinic, they're going to give you a description of your visit summary. Just add that in there. Your doctors and your providers list, put everybody down. Your primary care physician, your cardiologist, neurologist, you know, urologist, whoever it is, put that on there. If you have advanced directives, put a copy in there. If you have a healthcare power of attorney, put a copy of that as well. Make sure that's all together. Very important. And so if you go back to that checklist, and Katie, you don't have to right now, but that is what was on the list that I sent Miller. This information, as well as the information on the next page, prompts everybody to get all this together for your emergency notebook and checklist.
And I can send that, Christy, to all the people, at least the people that fill out the survey. I can send that to everybody who was on this call.
Perfect, perfect. Next, okay, so when is the last time you saw your physician? Very important, right? Just make sure that you've got, and again, all that has to be is if you've got that visit summary, just stick that in there. When is the last time you had a medication change? What if your doctor just started you on a new medication? You're having an interaction from that medication. Your family calls EMS because you're having a behavior change, a medical change, whatever it is. You can't go, nobody can go in with you to the emergency room. And what if it's a reaction because of that medication? So that would be very important to put that on there. So at least the doctors and the nurses can start kind of peeling back the mystery or the onion, if you will, as to what may be happening in this situation. So what was the medication change? Have you had any side effects or problems with previous medications? Okay. You know, a lot of our clients with dementia will experience hospital delirium when they go into a new setting, particularly the emergency room or the hospital. If that's something that we know our loved one is going to experience, put that on there, because sometimes emergency room staff could possibly throw a behavior medicine on a client or a patient because of that behavior and everything else. And if your loved ones had problems with those type medications in the past, obviously that's not the right solution for this person. You know, we've had clients where they have complained of sleeping issues, have had hospital delirium, different things, and the doctors have prescribed things that not only caused more problems, but exacerbated them. You know, for instance, we had a client who clearly could not take any type of sleeping medicine except for something like a melatonin. And then she'd go to the hospital, she'd be complaining about these things, and the doctors would start doing different medications for sleep. And now all of a sudden her hospital delirium is off the charts, her behaviors are off the charts, and they're wondering what's going on. They want to throw different meds on them. We need to make sure we describe all that. Does your loved one react differently with pain medicine? You know, if they've had a reaction before in the past on Lortabs or different things like that, make sure we've got all that in there so that it just helps the doctors and the nurses better streamline what they're going to do to help that particular patient. What's their baseline information? This is very important. This kind of goes back to that letter to the healthcare team. If I'm an individual who I can walk around by myself, I can get up and down from a chair. Yeah, my gait is a little off, but you know what? I can walk around with a walker. I've been able to go to the bathroom by myself for the most part. I've been able to make choices. I've been able to feed myself. I might have been able to even drive around. I've been able to do all kinds of different things. And now all of a sudden, I find myself in the hospital with a lot of different things going on, and I can't speak for myself. Great example. I've had this personal experience, not only with my aunt, but with my dad. And last year, due to a couple of medical issues in the hospital, my dad, who was driving, walked himself into the emergency room. And now 3 weeks later, couldn't tell the doctors his name, couldn't explain that I was his daughter, anything like that. Clearly something was going on. And it was up to my mom and me to go, this is not what's right. This is not what's normal for my dad. This is what he usually does. He doesn't have a diagnosis of dementia. You know, he was walking before he did this. You know, what do we need to look at? Start carving back some of these things. And it doesn't mean that you have to have all these healthcare procedures and what have you. Maybe it's as simple as just checking some labs to see what may be off. So real important that you describe to the healthcare team, especially the healthcare team that's never met has never met you or has never met your loved one. What do they typically look like, right? So we look at their mobility, their ability to speak for themselves, their cognitive ability. Maybe they have, you know, mild cognitive impairment or even moderate cognitive impairment. But if they're in there and they're completely unable to speak for themselves and they're hallucinating and whatever else, the healthcare team needs to know this is not what they normally look like. And can they actually tell the providers what their normal medical history is? If they can't, again, that's up to us. So that letter to the healthcare team is very, very important. And has that person picked an advocate to speak for them? Is it their spouse? Is it their adult child? Is it a care manager? Is it a neighbor? Who is it? And make sure you give that information to the advocate so that they can speak on behalf of you. So how to prepare for emergency care. So now we're in a situation where we've got to go to the emergency room. It's a fall, it's a major physical change, behavior change, whatever it is, it's now time to go to the emergency room. And even before COVID, this is a scary situation. Now it's very scary because people can't go in there with you. They can't advocate with you. So you've got that emergency notebook. Have copies of what's in that notebook, just that checklist. Give a copy to EMS. Ask the EMS provider to give a copy to the emergency room when they go. Because guess what? A lot of times things aren't transitioned. We'll even find when shift change happens that it's not transitioned. If your loved one it is admitted inpatient, be prepared to send that same notebook via fax to the providers on the inpatient unit. So that's, have duplicate copies. Very important to make sure that you've got that information and it can be passed down, because right now in the emergency room, unless things have changed, once you're dropped off with EMS, you're in there by yourself. So again, having this information is very important. All right, next page. All right, inpatient care checklist. So things to ask, particularly for that hospital. What is the hospital's protocol for initial hospitalization? So in some situations, we've had some clients that needed a psych inpatient hospitalization. They went to the emergency room and where it depends on that particular hospital, but you need to know this information. Once they go to the emergency room, is there an inpatient kind of quarantine unit for that particular, like in this, for instance, it was for a psych evaluation. So you need to know that, and just know that although they may be on that unit and you may establish relationships with the social worker, with the doctor that's there, they could have to move to another unit based on whatever their COVID protocol is. If it's in, like, let's say a regular med surg floor, like a normal inpatient unit, what's the criteria or what's their protocol or policy for any kind of visitors? Can they have one visitor? If your loved one needs caregivers because safety risks, can they have caregivers? What's the hospital's policy for having caregivers? We've seen different things in hospitals. Typically, in some of them, they've allowed at least one caregiver if it's been a safety issue, but not everybody, right? And then when you're transitioning to another skilled nursing or what have you, you're going to have to follow those protocols as well. So how do I establish communication with the unit? And this is something that's an ongoing challenge. You know, you can establish relationship with that day shift nurse, and you've had great experience with that day shift nurse for 4 days, and now it's time for that day shift nurse to go to to go off for a few days. Now you got to establish with the next person. But make sure you can at least identify one person that can be someone that can help you advocate for your loved one through this process. Make sure you fax the emergency notebook information to that inpatient unit. And again, be prepared to fax again if they move to other units, and advocate. While you're advocating, know that the stress that the hospitals are having, the skilled nursings are having, long-term care community, all of them, know that they are under a ton of stress, and that everybody is wanting communication for their loved ones. So if we look at this as a team approach, as I'm trying to help you provide the best care for this patient, really can be the way to start that relationship with them. But be prepared to advocate and continue to follow up. Okay. The next few slides are a lot of questions, because everything really changes. And I had my team send a couple of tips that they've used throughout the last several months. And I will say, I have the most incredible team, and those, particularly my 3 care managers, have navigated these waters so well with our clients that are in communities, and I learn from them every day, every week, as to new tips and ways to help our families and help our clients. And so a lot of these have come from our own experiences of navigating through this to make sure that our clients are getting the best care. Loving and caring for family and long-term care communities. Well, probably the first thing we've got to be aware of is prepare that things are going to change. Just as much as that we don't know, they don't know what protocols are going to change, and everybody's under a lot of stress. So first, who is my point person for receiving ongoing communication about my loved one? You know, it may not be the DON, the director of nursing. Maybe it's the unit coordinator on that particular floor. Maybe it's a particular nurse on a particular shift that you already had a relationship with, and you can count on contacting that particular person at certain times to receive information and to share information. And then if you need to just continue to follow, if you don't have that person, how can you build that? You know, can you send emails with information or questions to make sure that you get that proper relationship? Are medical home visits a possibility for your person that's in a community? So do they already have a medical director that comes in with a nurse practitioner that's there, and if they aren't established with that physician or that nurse practitioner, can we go ahead and get them established? If they meet a criteria for hospice or home health, can we look at a possible admission for either of those services if their physician feels like it's appropriate? And what is the protocol right now for that facility on allowing home health and hospice providers to come in? We've all experienced where no outside providers, including even hospice nurses, have been allowed to come into communities. And again, this is all daily changes that these facilities are experiencing. Be prepared for protocols and rules to change, and communicate, communicate, communicate. This is really important. Be their voice. Make sure that your loved one has somebody that's contacting the communities that can be their voice during this time. You know, if they have a smartphone or a flip phone or whatever, is there a CNA that you can contact to make sure that it's plugged up, and that is there a time then maybe when they're in there helping your loved one, you can contact and at least just hear their voice. It's just, you know, we're all experiencing these changes, and I really struggled on what points to give everybody on this last objective, because it changes all the time. Just a couple of things that our team came up with. Again, knowing someone prior to the quarantine was very helpful because they can contact that person directly. But then when we had a particular client that was in one level of care, a SCALF, and then needed to move to a higher level for long-term nursing home, we had to completely reestablish that relationship. And so one of the things that one of our care managers did was to introduce herself to the nurses and the caregivers over phone, provide that, remember that letter to healthcare providers, provide that information to them, provide how to adjust with this person. This is one of our clients that definitely can have some behavior and agitation issues. And so we provided to that next level of care how to appropriately and effectively bathe the person. What about dressing? What about when they become sad or refuse a medication or something like that? What are some tricks and tips that we've seen successful at the other unit, that you can provide here? Anything that can help the healthcare team provide the best care is always going to be useful and great information. And again, it's just showing that you're part of the team. Next page. So what is the protocol if my loved one goes to a medical appointment outside the community? This is where we've kind of seen all kinds of different situations. Typically, if someone has to go have a procedure, have an appointment, if they have to have a specific procedure and then come back, know what the protocol is. If you're in one of the bigger CCRCs, typically those continuous care communities will have one area that anybody that's been out, any of the residents that have been outside the facility have to go there for 14 days, have to have the COVID test, what have you. You got to be prepared for that and know that ahead of time. And also, guess what? That's a new unit. So now my loved one's been in assisted living or been in independent living. They have to have a procedure, and based on the rules of that community, they're now going to be quarantined in a whole nother unit with a whole nother new level of staff. Again, having that information that you can share with the team that they're taking care of can get a better picture for the nurses and the CNAs that are helping them. We had one lady that definitely had to have a particular procedure, and she has this procedure every month. Well, they were not going to allow, we couldn't find the appropriate nursing staff that could come in and do this particular procedure. It's one that really can only be done at the clinic. And when she came back, she had to be quarantined. And because she has dementia and she likes to wander, not only did she have to stay, quarantined in her space, but we also had to implement caregivers, which was an outside cost for the family. We had to implement caregivers so that during the day, she wouldn't start wandering through the unit. All these things are changing, and so it's very important to be aware of those things. What are the options for my loved one to receive medical care inside the community? So, a lot of our communities have an appropriate medical director or nurse practitioners that come in. What if it's independent living? Are there options to move to a house calls program or something like that? Or if I was with an outside provider, can I switch to the medical team that's inside that community? And again, this kind of goes back to the other things too. What if my loved one requires hospitalization? What is the return admission policy? Typically, those are going to be exactly the same based on even just someone having to go out for a procedure. Just be aware that these things, this is the world we're living in right now. And those communities, they're having to follow these guidelines. And so it doesn't matter about all the complaining we can do. You just have to follow these new steps and protocols. If your loved one's in assisted living, memory care, or a nursing home, when should I expect a care plan or a plan of care meeting? If you're in the nursing home and you're long-term, you should be having quarterly meetings. So make sure that if it's been a while since you've had a care plan meeting, you ask for these things and that you can have that care plan meeting with the healthcare team that's there. If they're moving into rehab or a place like Lakeshore or Spain, ask them upon admission what to expect and when to expect those different either treatment meetings or care plan meetings for the short-term stay. If your loved one's in assisted living or specialty care, ask them how they're conducting plan of care meetings. Are they conducting plan of care meetings? Again, that's all going to be based on what exactly the facility protocol is. Okay? All right. When and how can I visit my loved one? Well, that's a continuous question, right? I don't know when we're going to be able to visit our loved ones. I do know in some communities, there have been some drive-by visits. We have a family whose loved one lives in a skilled nursing, and they were able to, mom was able to come out and kind of be at the front doors, and the family was able to, be many feet away in the porte-cochere area or the drive area, and we're able to at least wave and can't, no hugs, nothing like that. But they could at least wave and communicate with them that way. Are the communities setting up FaceTime for you? And if so, when can that happen? Zoom, different things like that. And be aware, this is something particularly that Nicole addressed. Don't be distressed if your loved one does not react positively to FaceTime or other video calling times. This is new to them. And if that loved one has dementia, they really don't understand that I am this person, right? We may have somebody try to do this and all you're seeing is your loved one's nostrils or whatever else. Sometimes maybe just good old telephone is the best way to communicate with them and hearing their voice. Make a memory book. Maybe it's 5 or 6 pages of a picture of you with your loved one and your names on it and I love you. Just something that you can hand them off. But be prepared to know the delivery process of that community. Ask ahead of time if you're going to deliver something like their favorite treat or a memory book. What is your process? Because in some communities, there's a drop off, they sanitize, then they take. You got to know and ask the questions ahead of time. Because if you show up and you get frustrated because they won't accept something or you didn't follow a protocol, everybody's just trying the best they can. Just being aware and having that knowledge ahead of time and being part of the team is going to be the best way that we can love our clients from afar. I mean, we're all facing this challenge together and it definitely is difficult. There is a program called GrandPads, and we're in the discovery process of learning a little bit about this. It's more user-friendly for our seniors than like an iPad or even a smartphone. And as I get more information, Miller, I'll share that with you guys. And that may be something that families can establish and utilize for their loved ones. And it's a lot less expensive than like an iPad or something like that. Okay. All right. Stay safe. Follow healthcare guidelines. We do care and love the most vulnerable population that's out there, and they are going to be the most susceptible. We're all tired of wearing these, but there's a reason why we wear them, right? Because we love one another. And if you don't want to wear them, well, then stay in your house or go someplace that you're not going to see anybody. I mean, my new daily activity, right? I have hand sanitizer. I've got this. I've got antibacterial wipes all over my car. Nicole wrote in some of her things, when she's had to take a client to a procedure, she's wiped down her entire car. She has a mask on. the client has a mask on, we're, following all these appropriate things. I think that I'm speaking to the choir here. We're probably the cleanest people out there right now, but just stay safe and be patient with one another, and know that nobody really knows what's coming next, but that's kind of where we are. And thank you, Miller, for this opportunity. And I hope all this information helps.
Oh, Christy, it's very, very helpful. And I think, it just gives people a lot of good food for thought that we've just got to slow down our expectations. And because if you go into any kind of encounter with the healthcare system right now with a lot of expectations, you're obviously going to be very disappointed and probably get really upset because, like you're saying, it's not just us that's learning a new system, so is the whole healthcare system. So flexibility is key, and I appreciate all that wisdom. Y'all, like we have done with our webinars that we've done so far, this will be archived on ACA's website. And so if you need to go back and hear a little part again, or if you think a family member would benefit, please send them to our website. And we put out a weekly dementia community calendar that gives information about things like this and other stuff going on in the community. So if any of y'all aren't getting that and would like to, please let me know. Looks like, Katie, you've got some CEU.
No, I was gonna, Vance had put a comment in the chat that says, Alicia just told him that at Grandview they can have family members if the patient is there for non-COVID reasons. If COVID, may not have a family member unless they need assistance or have mental deficits. And then he wrote that would be in the ER only.
Okay. Thank you. See, I mean, it changes all the time, and having connections with the different hospitals, very important. We all have to come together and just share the wealth with one another, because something I don't know, Katie may know, or Vance knows, or Miller knows. We just got to do this together.
And I think that is, as far as CEUs go, just remember to fill out the survey. And I think Sherry's she just put the link in the chat. And you'll also get it, if you're not looking at the chat, you'll get it when this is over. If you are calling in, please email Miller or Sherry or someone and just let us know you're here. And Christy, that was awesome.
Thank you, Katie. Thank you.
Good. Thank you, everybody. Christy, we appreciate you, and Nicole and everybody over at Life Care for Seniors.
Thank you. I'm
all right.
Glad to be part.
All right. See y'all soon.
Bye, guys. Stay safe.